So let's now take a look at a variety of different drugs that we're going to be looking at during the semester. We'll start off with opiates. Opiates produce pain relief. So we use the word analgesic for that. So a drug that produces pain relief is an analgesic. It's a particular type of analgesic, of course. So it works differently than, say, aspirin might. It is a hypnotic, which means that it is sleep-inducing. It also produces euphoria, strong feelings of happiness. And examples of opiates include morphine, which is naturally occurring from the poppy, and heroin, which is synthesized from morphine, and then other drugs that are chemically very similar, like OxyContin. So those are all opiates. And of course, you know that opiates are problematic because of their addictive potential. They produce withdrawal symptoms and can be fatal because they do suppress respiration. Alcohol is another drug that we'll be dealing with often. It has many effects on behavior. It inhibits neural activity, and therefore it is classified as a sedative. Now, you might be sitting there going, what do you mean alcohol is not a sedative? It can feel like a stimulant because it turns off cortical inhibition. So it sort of releases a person's inhibitions. And as a result, the first reaction of a person might be to be more excited and more enthusiastic about something. It can feel very energizing in that way, but it is definitely working by reducing neural activity, and it is a sedative. At higher doses, alcohol produces sedative and hypnotic effects. In other words, it will calm you, but also make you sleepy. Alcohol has negative effects on health. Acute effects include alcohol-induced coma or death if too much is consumed. Chronic effects include liver damage and brain damage associated with Korsakoff syndrome. Withdrawal is actually dangerous in a person who is physically dependent, and it may produce a condition known as delirium tremens. These are hallucinations, delusions, confusion, and in extreme cases, seizures and possible death. So I want you to take a moment and think about what we're seeing here with the withdrawal symptoms. Hallucinations, delusions, confusion, in extreme cases, seizures and possible death. The seizures are a great example, but also the DTs, the delirium tremens, are a great example of how withdrawal symptoms are in many cases the opposite the effects of the drug. So what is alcohol? Alcohol is a sedative. And so it reduces neural activity. In a person who drinks regularly, the effects of homeostasis, or the body's attempt to maintain homeostasis, means that the body is compensating by enhancing neural activity. And so what happens when the person ceases to drink? All of a sudden, all you have now is enhanced neural activity, extra neural activity beyond what is appropriate can result in these hallucinations, delusions, and seizures. So this enhanced neural activity we're seeing can even produce seizures in people that are dependent on alcohol, that have been using alcohol for a long time. Here we're seeing some of the effects of chronic alcohol consumption in the brain. And so we're seeing that in this 46-year-old alcoholic man with an alcohol consumption over the lifetime, I calculated it out at about 412 gallons of alcohol, and over 26 years since he was, if he was drinking since he was 20, that would mean that he drank 15 gallons per year, which is quite a bit. But you can see these large, basically holes in the brain, right? These are not just random holes, they are ventricles. So we all have ventricles in the brain. But when compared to the size of the ventricles in a matched male of the same age with a much reduced amount of alcohol consumption, we see that the ventricles in this case, are really enlarged. And that's a really common thing that we're going to see repeatedly through the class too. Whenever there is brain damage that results in loss of neural tissue, we tend to see these enlarged ventricles. So large ventricles are a sure sign that there's been loss of neural tissue. And so we're seeing that here really substantially. And as we go through the course, you'll see that while there are a lot of conditions that produce some amount of loss of neural tissue and enlarged ventricles, the magnitude that we're seeing here is really big. So chronic alcohol use is certainly a problematic thing and really affects the brain. Alcohol inhibits the neurotransmitter glutamate, which is, remember, our excitatory neurotransmitter. It binds to the alcohol part of the GABA A receptor. So if we look over here, we can see the alcohol receptor site. And so alcohol will bind here and reduce neural activity by binding to this GABA receptor. Remember, GABA is the inhibitory neurotransmitter, right? So when you stimulate GABA, you get more chloride, which is a negative ion, and you reduce neural activity. The combined effect of reducing glutamate and enhancing GABA results in sedation and also what's called an anxiolytic effect. The anxiolytic effect means that it is reducing anxiety. So you can see the root word here for anxiety, right? So an anxiolytic is a substance that reduces anxiety. It also produces muscle relaxation and inhibits cognition and also badly affects motor skills. Alcohol's pleasurable effects are likely due to the stimulation of opiate, serotonin, and cannabinoid receptors. So there are interesting links between cannabinoids and alcohol and opiates that are being studied. Also acting on the GABA receptor, so producing this sedation and inhibition of neural activity, are barbiturates. They were once the drug of choice for treating things like anxiety and insomnia, but they are no longer used in that capacity because of the tolerance that develops very quickly. So you get a lot of tolerance fairly quickly with the use of barbiturates. And then people need to start increasing the dose more and more. And if they don't do so, then they have trouble sleeping and so on. So it's not ideal because of that. Benzodiazepines are safer, but still risky for in terms of treating anxiety because they do produce some level of tolerance. So they are still problematic in that sense. They also can interfere with just, cognitive activity. And so like in older people, the negative effects on their cognition is particularly bad because as they're aging, cognition might already be a little bit diminished. And so it kind of compounds those problems as well. Benzodiazepines decrease activity in the amygdala. So you can see if you reduce activity in the amygdala, which is associated with emotion and anxiety, you can probably reduce anxiety that way. Also reduces activity in the hippocampus. Oh no, how will I ever remember anything if I'm taking a benzodiazepine while I'm going to school, right? So the effects of benzodiazepines on the hippocampus can be detrimental to learning and memory. Also affects the brainstem and basically has broad effects throughout the cortex. Cocaine is a stimulant. It activates the central nervous system and it produces arousal and alertness. It comes from the coca plant, traditionally used in South America, in Peru. And it blocks dopamine and serotonin reuptake. So remember reuptake. This is what happens after a neurotransmitter is released into the synapse and the excess is taken back in and repackaged right into the vesicles. If you block reuptake of a neurotransmitter, that means that that drug is leaving it out there in the synapse longer, and the longer it stays in that synapse without being reuptaken, the more of an effect it has. And so it is a agonist for dopamine. So cocaine is a dopamine agonist and a serotonin agonist. Cocaine does produce some deficits in executive functions that involve the prefrontal cortex. And this again is with repeated use. It can be addictive due to the intense withdrawal, but I do want to point out one thing that's kind of interesting. It produces very mild withdrawal symptoms. So here's a drug that is addictive but does not produce a lot of withdrawal. Now take a look at the pictures we're looking at here. And on the top row we have normal brain activity, and colors yellow and red indicate a higher amount of neural activity, and blue indicates a lower amount of neural activity. And not terribly surprising, in a person who has been using cocaine and has been without using it for 10 days is in the midst of, sort of this reduced level of brain activity. And so you can see that without the cocaine, their brain activity is very, very reduced relative to like a baseline that you would see here with the person that has not been using cocaine. And what this graph is showing here is that even after 100 days of not using cocaine, we still see this reduced level of neural activity. So this is a classic, set of research findings that demonstrate potentially some of the long-term effects of cocaine abuse. But I want you to think critically about this graph and remember the correlation is not causation, principle. So what are we seeing here? Have we isolated cocaine as the cause of this reduction in brain activity? Do we know what these individuals' brain activity was before they started using cocaine? We don't, right? Because we don't do these types of experiments in humans. We don't take a human and take 100 humans and 50 of them randomly get cocaine and the other 50 don't. So when we look at this type of study, we don't have a random sample and we don't have a baseline, and therefore what we do have is a correlation, essentially, because we cannot really say that this is what their brain would have looked like before they ever used cocaine. And that's actually one of the interesting lines of research with drug use, is that there might be pre-existing differences in brain activity that can predate drug use, so that we're not always sure when we see that the brains of drug users differ from the brains of non-drug users. We can't always say that that's because of the drug use. It may have been a pre-existing difference. And so I just kind of point this out just to make sure that we're thinking critically as we go through and look at data like this. But definitely very interesting and intriguing data, right? About the potential effects of cocaine on brain activity, even after use has been stopped. Amphetamine is also a stimulant. Amphetamines are a group of synthetic drugs that produce euphoria, certainly also increase confidence and concentration. Examples include benzodrine, dexedrine, and methamphetamine. It increases the release of the neurotransmitter norepinephrine, so associated with arousal, as well as dopamine, associated with rewarding effects in the brain. And with high doses taken over a period of time, a few days, drug-induced psychosis is possible. Nicotine is the primary psychoactive ingredient in tobacco, and it stimulates the acetylcholine receptors, in particular the nicotinic acetylcholine receptors. So in the periphery of our bodies, it activates muscles and can cause some twitching of the muscles, but centrally in the brain, it produces increased alertness and faster response to stimulation. Only 20% of attempts to stop nicotine use are successful after 2 years. So nicotine is actually one of the most difficult drugs to stop using, and it is also certainly one of the most dangerous and one of the ones that's associated with the greatest number of health risks. So in terms of dangerous drugs, we're seeing alcohol and nicotine are really, really the most dangerous ones in terms of our in terms of challenges to health. Now, caffeine is a drug. It is the active ingredient in coffee and certainly in a lot of other beverages. It produces arousal, increased alertness, decreased sleepiness, which is why a lot of people might use it to either wake up in the morning or as a pick-me-up in the afternoon, or if you're studying to be able to stay awake and alert. It works by blocking receptors for something called adenosine. Now, adenosine is not really a neurotransmitter, it's called a neuromodulator in that it modulates or makes adjustments to other neurotransmitter systems. And basically what adenosine is it's a byproduct of neural activity, or cellular activity. And so during the day, your cells are active, adenosine builds up, and that becomes one of the cues for your brain to signal sleepiness and tiredness. And so by blocking the receptors for adenosine, our brains lose that message that's telling us that we're tired. And so you can see why that would increase alertness. It also increases the release of dopamine, so it definitely is rewarding, although it does it through a non-direct way. It doesn't quite do it as directly as other drugs that are, certainly more addictive and rewarding. And it also increases acetylcholine. Withdrawal symptoms are generally, in terms of drug withdrawal symptoms, fairly mild. It does include headaches, fatigue, anxiety, shakiness, and craving. And the headaches come because adenosine normally constricts blood vessels. And so if you drink a lot of caffeine, then those blood vessels are going to have, a higher blood pressure. Psychedelic drugs are compounds that cause perceptual distortions. They're sometimes referred to as hallucinogenic drugs. There's really no good label for these drugs. They act kind of differently in different, depending on the drug, and they can even act differently in different contexts and in different people. So it's not a tight category of drug like some of the other ones are. But they are noted for producing changes in moods and perhaps altering or enhancing perceptions. And examples include LSD, also known as acid, mushrooms or psilocybin, mescaline, PCB, and ecstasy. So ecstasy, also known as MDMA, is a stimulant at low doses, and it does release dopamine, so it does have that rewarding effect. At higher doses, it releases serotonin and starts to produce mild hallucinations. So it can produce hallucinations or some kind of hallucinatory effects similar to some of the other psychedelic drugs. That's why it's classified as a psychedelic drug and not really as a stimulant. It is associated with cognitive deficits such as memory loss. There is research showing that MDMA can destroy serotonergic neurons. It can produce a large amount of serotonin release. And there's actually some support in humans that this might happen. But it's also possible that with time that there can be some recovery